today we are going to learn about a very important molecule which is very often used nowadays for the management, oral management of diabetes mellitus, especially in adults. The name of this molecule is sitagliptin. This sitagliptin comes from a very important class of oral anti-diabetic medications. And this class in short is called as gliptins. Now, what are gliptins? Gliptins pharmacologically or molecule wise, they come under the category of dipeptidyl peptidase 4 inhibitors. Big name. So in short, it is called as DPP4 inhibitors. Dipeptidyl peptidase 4 inhibitors, DPP4 inhibitors. Okay. Now, how do they work? They work by blocking the action of an enzyme called DPP4, that is dipeptidyl peptidase enzyme. DPP4 is an enzyme which destroys a group of gastrointestinal hormones called incretins. Now, what are incretins? Incretins are hormones which help stimulate the production of insulin when it is needed. That is, for example, after eating, and reduce the production of the hormone glucagon when it is not needed. That is during digestion. These DPP4 enzymes or these incretins, they also slow down the digestion and decrease the appetite. So therefore, by protecting incretins from damage, DPP4 inhibitors, they help regulate the blood glucose levels. So that is in short how the DPP4 inhibitors work. As I've said, DPP4 inhibitors, there are lots of gliptins in this category. For example, sitagliptin, teneligliptin, saxagliptin, vildagliptin, etc., etc. They have all common features, being members of the same category, such as mechanism of action, side effects, precautions, warnings, usage, etc., etc. And therefore, today, since sitagliptin is a very widely used gliptin, today we'll like to learn a little more about this molecule, that is sitagliptin. So what you need to know before taking sitagliptin, first of all, do not take sitagliptin if you are allergic to sitagliptin or any of the molecules or any of the ingredients which are used in the formation of the sitagliptin tablet. That is number one. What are the warnings and precautions before taking or during taking of sitagliptin? It has been reported that there is inflammation of pancreas. It is called as pancreatitis. It has been reported that patients receiving sitagliptin can have pancreatitis. If you encounter blistering of skin, it may be a warranty or it may cause a condition called bullous pemphigoid. It's a skin dermatological problem. So if you get it, your doctor will tell you to stop sitagliptin. In addition, you should tell your doctor if you have had in the past or if you are having pancreatitis, you may be a patient of pancreatitis. Then if you are having gallstones or you are suppose alcohol dependent, having a lot of alcohol every day, or you have hypertriglyceridemia, that is, triglycerides are a different type of fat. So if you are having that increased levels of triglycerides, then you should report to the doctor. And what is more important is these medical conditions, they increase your chance of getting pancreatitis. Then obviously, if you are a type 1 diabetic patient, which is relatively rare in adults, then if you have diabetic ketoacidosis. Now, what is ketoacidosis? Diabetic ketoacidosis is a complication of diabetes, which is shown by high blood sugar, rapid weight loss, nausea, and vomiting. Then, of course, any past or present kidney problems and allergic, I have already told you. The fun of sitagliptin is it does not, or it is unlikely to lower the blood sugar, because it doesn't work when your blood sugar is low, simple. However, when it is used in combination with other blood sugar lowering medications such as insulin, sulfonylurea, metformin, etc., then hypoglycemia can occur. And therefore, your doctor may reduce the dose of sitagliptin proportionally or the other anti-diabetic medications. So therefore, it is very imperative that you should be telling the doctor whether you're taking or whether you're on any other medications. What about driving and using machines? Sitagliptin has no or negligible influence on the ability to drive or use machines. But however, dizziness and drowsiness have been reported, which may affect the patient's ability to drive or use machines. So one has to be careful. Taking sitagliptin in combination with medicines called sulfonylureas or with insulin, they cause hypoglycemia, which may again lead to a sort of effect on the ability to drive or machines. Does sitagliptin contain sodium? Yes, very important, because many of the diabetics can be hypertensive. But please remember that sitagliptin contains very less amount of sodium, that is something like 1 micromolecule of sodium, that is 23 milligrams per tablet, and therefore practically it is sodium free. How to take sitagliptin? Always take sitagliptin exactly as your doctor has told you, and check with your doctor or pharmacist if you are not sure. The usually recommended dose is 100 milligram film coated tablet once a day by month. If you have kidney problems, your doctor may reduce the dose, etc., etc. He may advise you to take 50 milligram or 25 milligram, whatever the case may be. You can take sitagliptin with or without food or drink. So food or drinking is immaterial while you're consuming sitagliptin. Your doctor may also prescribe sitagliptin alone with other medicines which may lower sugar, which I told you earlier. So accordingly, we have to take that precaution. What about diet and exercise? Now, diet and exercise surely help your body to reduce the blood sugar better. And it is important, therefore, to stay on the diet and exercise as recommended by your doctor while taking sitagliptin. So what happens if you take more amount of sitagliptins than you should? If you take it so, then you have to contact your doctor immediately, and then he'll tell you what restrictive measures have to be taken. Another important point, what if you forget to take sitagliptin? If you miss a dose, take it as soon as you remember. If you do not remember this,
sorry, तुम्ही प्रश्न विचारल्यानंतर पॉज घेताय.
प्रश्न विचारण्याचा पॉज घ्यायचा. ठीक आहे, ठीक आहे, ओके. If you miss a dose, take it as soon as you remember. And it's possible if you don't remember until it's time for your next dose, skip the missed dose and go back to your regular schedule. Please do not take sitagliptin in a double dose form. What if you stop taking sitagliptin? Remember, please continue to take sitagliptin as long as your doctor prescribes it, so that you can continue to help control your blood sugar in a better and effective way. You should not stop sitagliptin unless you talk to your doctor. If you have any further questions on use of sitagliptin, definitely you should ask your doctor, whatever the questions may be. What are the possible side effects of sitagliptin? Well, like all medicines, sitagliptin can cause side effects, but it's not necessary that all of you or everybody can get them. However, the common side effects of sitagliptins, like other DPP4 inhibitors, include gastrointestinal problems like nausea, diarrhea, stomach pain, flu-like symptoms like headache, runny nose, or sore throat, skin reactions, that is painful skin followed by a red or purple rash. If you have a reaction which causes difficulty in breathing or a very severe skin reaction, please call for medical help. DPP4, which I told you earlier, have been inhibitors. What I'm saying is they have been linked with an increased risk of pancreatitis. And therefore, pancreas lies in the abdomen, in the upper abdomen. And therefore, if you experience severe pain in your upper abdomen, which may be accompanied by nausea and or vomiting, then immediately contact your doctor. Stop taking sitagliptin and contact the doctor immediately if you come across very serious side effects like severe and persistent pain in the upper abdomen, which might go to your back with or without nausea and vomiting, because this can be dangerous warning of pancreatitis. If you have serious allergic reactions like rash or hives or blisters on the skin, then there can be peeling of the skin, swelling of the face, lips, tongue, etc., etc. Or if there is difficulty in swallowing, these are all serious side effects. Immediately contact your doctor. Some patients may experience more or different side effects if, in addition to sitagliptin, they are taking another anti-diabetic medicine like metformin or insulin or sulfonylurea, etc., etc. So whatever may be the case, you should contact your doctor. The reporting of the side effects of the molecule is very paramount. How to store sitagliptin? First of all, keep sitagliptin out of the sight and reach of small children. Please do not use sitagliptin after the expiry date, which is stated on the blister strip or carton. Sitagliptin does not require any special storage condition, but please see to it that it is not kept in a very humid or very hot conditions. Do not throw away the medicines via wastewater or household waste. How are sitagliptin tablets available in the market? Each sitagliptin 25 or 50 or 100 milligram, it's a film coated tablet, contains sitagliptin phosphate monohydrate, that's the salt, equivalent to 25 or 50 or 100 milligrams of sitagliptin. And it's available in strips of either 7 tablets or 10 or 15 or 28, depending upon the company which is marketing it. So at the end, I may say that I hope that this information regarding sitagliptin, a very important DPP4 inhibitor molecule, which is used in the oral management of diabetes mellitus, will be useful to you when you are taking the tablet. Thank you.